My name is Saeed Hassanpour, and I'm a faculty in the Department of Biomedical Data Science at Geisel at Dartmouth Medical School, and also founding director of Dartmouth Center for Precision Health and AI. I also have been asked to set up a discussion a little bit, maybe give you, if you have, if you don't know about this sector, maybe give a little bit of a statistics information. So as probably all of you know, currently healthcare is about 18% of US GDP. And globally, there's a lot of investment in this domain. So in the last year, 2024, the global investment in healthcare only in private equity was more than $115 billion. And this number is expected to grow for foreseeable future. And also, we see a new wave of applications and innovations in this domain, from precision health and personalized care, especially for cancer care, to ambience AI and all the new technology that goes in healthcare and healthcare administration to prevent the waste and also the administrative burden and a lot of the paperwork, and make it easier. Also, there's a lot of innovation and excitement in drug discovery and drug repurposing, and also in consumer health and in wearable and hardware technology. There's a lot of new opportunities and applications. And we have a very exciting and world experts panel of panelists today that are going to tell us more, and we are going to take questions from audience. I'm going to let our panelists first introduce themselves and give us a little bit of brief overview of their journey and how they end up at this stage in their career. And then I'm going to start with a few questions, and we're going to open it. We have a very, very intimate discussion. So I encourage everyone to think about questions as we go forward to ask our panelists. So let's start with Nasim, please.
Yeah, sure. Hi, everyone. Good afternoon. Thank you so much for coming to this session. I'm Nasim Afsar. I'm a physician by training and background. I trained in internal medicine and worked as a hospitalist for over a decade, taking care of acutely ill patients in the hospital. I got into healthcare administration about 2 decades ago, really looking at how can we create and innovate to bring forth health, better care for both individuals and populations. And when I started 2 decades ago, we had a different set of tools than we do today, but working through at any given time what's the most powerful tool that we have at our disposal is kind of what got me to here. I was in a number of executive positions on delivery side, including Chief Operating Officer of a healthcare delivery system for about 5 years. And then I was recruited over to Oracle as their inaugural Chief Health Officer as they were trying to figure out what it means for a technology company to be in healthcare. And there I got to work with healthcare delivery systems across the globe, payers, pharma, med device companies, retail, food and beverage. Basically, as you all know, everyone wants to be in health and care. And looking at how do we leverage the technologies that we have, everything from cloud and cloud computing to AI and generative AI tools to advance health outcomes as well as financial and operational metrics. And I transitioned out of Oracle to take a little sabbatical to write a book, which is what's on your desks if you guys want to enter to get a free book. I was thrilled that my publisher allowed me to do that. But really looking at how do we leverage AI to be able to improve health and care for people.
Great. Tough act to follow. I'm Julie Skaff. I'm actually in between companies right now. So most recently I was at Viz.ai, which is an AI startup, but is now focused on basically closing gaps in care and expediting care, leveraging AI in neuro, cardiology, cardiovascular, oncology, orthopedics, a number of specialty areas, and is used in about 1,800 hospitals today in the US. I just left Viz to join a company called Centaur, which Alex is nodding, so that's always nice, but you probably know because I mentioned it. It's an earlier stage company, which is much more focused on the model improvement, data labeling aspects of models, focused on healthcare, but also looking at those other high consequence verticals where quality matters significantly. And so I'm a T'08. Before I was in the AI health tech space, I was in health tech for 10 years at a company called Included Health, Uda Health, Castlade Health before that, and I did a stint in consulting after Tuck. So happy to be here.
Alex Morgan. So I've known Saeed for something like 15, 20 years at this point. We met at Stanford back in the day.
Since preschool, right?
Yeah, well, yeah. So since it's 2025, I'm now able to say I've been working at the intersection of AI and healthcare and biotech for 25 years. But the last 10 years of which has been at Coastal Ventures, where I lead our health and bio portfolio, which is now 120 companies in health and bio. So the firm as a whole invests in rockets and fusion and a lot in AI. And AI flavors a lot of the investments we do in health and biotech, including the first FDA-approved AI diagnostic at AliveCore. We have invested in a lot of the companies in AI drug, the sort of first and second gen of AI drug discovery companies. So I am happy to be here and happy to answer any questions and to the best of my ability about stuff that we're working on and stuff that we're interested in.
Great, thank you. Thank you very much for the introduction. As you see, we have a very exciting mixture of different expertise. We have physicians and also, PhDs and MBAs. So it is very exciting to have people that they can look at the problem in this sector from different aspects. So I'm gonna just start with a question, and we take it from there. So actually, in the multiple panels, it came up. There's a huge amount of excitement, especially in venture capital, in the investment world in terms of AI, and a lot of money is being thrown at different startups, at different businesses, and somebody told earlier that there might be a bubble. So which is we can get into that. But before that, I want to ask about opportunities here. So what is the $1 billion opportunity in healthcare that is ripe and ready for disruption, and why it has not happened yet? So maybe we'll start from Alex, who thinks about these kind of problems every day.
Okay, so there's like 3 or so questions there that maybe I'll try to unpack a little bit. The first is that AI tools and technology is very clearly already changing the world, and I would contend already generating billions of dollars of value. Almost certainly 2 things are true. One is that it is a major driver of value creation for the next several years. We don't know, how things will progress decades from now, but certainly in the frame of decades, a massive driver of value creation. It doesn't mean that every company that's raising and taking in a bunch of money will be that winner or be a winner and be that valuable in the end, or even return any capital to investors. But we see this in any big transformative period where the early first generation of kind of the home computer, where a lot of brands and companies had a bunch of money, had some early successes. It doesn't mean they persisted and they were the winners. Many of you probably in your pocket have one of the winners from the first gen. Same thing in the early days of e-commerce. Lots of money was thrown into lots of e-commerce companies. Internet search, right? There were lots of search companies. There were lots of e-commerce companies that raised a lot of money. But in each of these phases, many of those companies ended up losing money for investors. But at the same time, an aggregate, the winners more than returned the investment and have generated immense amounts of value for their investors and for the world. And if you look at the top 10 companies by market cap in the United States today, they're all fairly new companies in the grand scheme of things that during these phases of innovation generated value to drive them to hundreds of billions of dollars of valuation. So healthcare, and then the last part is you said healthcare, like $1 billion is easy to some extent in healthcare. You have over $1 trillion of reimbursed healthcare spend every year, over $1 trillion of consumer health spend, healthcare spend. Tremendous areas of opportunity for there literally to be thousands of billion-dollar companies. And I actually think as we move to the future in healthcare, a lot of things in healthcare actually don't generate that much health and wellness. They often do care, so they do some labor services thing at fairly low margin, maybe not extending life and wellness and health span in the way that most people would want. We are seeing lots of innovation on the technology side, where I think a whole new wave of innovation that will create tremendous value and health and wellness for individuals is arriving and will continue to accelerate. The pace of innovation has never been as slow as it is today. It's only going to accelerate, and we're just crossing over. You can see that, just I'll give an example in the wellness and health space. Statins, I would contend, are longevity drugs that have really transformed the world, right? Beginning of the 20th century, people died of natural causes. By the end of the 20th century, we had this concept of biomarkers and strokes and heart attacks, and we actually would intervene on them and prevent them. GLP-1 agonists are a new entrant in that category. And the number of kinds of drugs that will increase health and wealth and health span will accelerate because the pace of innovation tools to develop them is only accelerating. The same thing is true of lots of areas of health and wellness, digital health, consumer health. Massive shift. AI is one of the things that's enabling a huge shift in creation so that hopefully us and the rest of the world will be in an era of abundance of health and wellness in the next decade.
Yeah, I want to add to what you said, Alex, because to your point, $1 billion is not a whole lot in healthcare. I mean, it's a $5 trillion system, which basically goes to say there's a lot of opportunity in there. So you asked for the $1 billion idea, I would give you the $600 billion idea, which is the tremendous amount of waste and inefficiency that we currently have in our healthcare delivery systems, where we can actually leverage technology like AI to be able to eliminate that. If you look at our payers, the tremendous amount of resources and administrative burden that is spent on claims adjudication and prior authorization, where all of these algorithmically, I think I talked to a couple of major payers who were saying 90 to 95% of this could actually be all automated and adjudicated in a more efficient way. Now, there is, just like with everything in technology, while there is good, you have to understand the unintended consequences and mitigate against that. We all know what happens if you optimize for claim adjudication and you're not actually optimizing for health, but cost cutting and efficiency. So you have to balance that. Having said that, those are problems that can be solved. If you look at clinical trials and how our ability to get life-saving therapies to people is limited by clinical trial recruitment and the length of time that it takes to identify a person and be able to get them to the right clinical trials, all of that can be enhanced and done much more efficiently through leveraging AI. And then you come to the healthcare delivery side, where we have tremendous operational waste on a day-to-day basis, everything from how we manage our appointments and our procedures to our supply chain. So I think that the good thing is that it's actually quite easy to have the $1 billion efficiency. I'm going to just say one more thing, which is one of the things that I hear a lot about from really bright people who are problem solving in healthcare is that they identify one problem and they come up with one point solution. And the challenge is, and I always share with them, if you solved one problem, there's like 99,000 other problems in healthcare. So it's not so much about the $1 billion problem, it's about how can you create an ecosystem of efficiency so that you're not solving just that one problem, but you're actually solving a whole host of problems to get those economies of scale and improvement.
Well, I think these are all great points, but I want to just play a little bit devil advocate. I know that in business school, people learn a lot from the analogy, like from hanging out with people from Tuck and also from GSP old days. Like people like analogy. This company is like the other company, or this sector is like the other sector. I really like the comparison to tech and to the early days of internet and web. But it's all, I believe it's all about timing. Because also, as you might know, Khosla Ventures, Alex company is one of the big investors in OpenAI. So let's think about the internet. So a lot of these web companies, they became huge, but those early web companies like Cisco, or the people that build the infrastructure for internet, they didn't share the same, the success of these trillion-dollar or billion-dollar, hundreds of billion-dollar companies like companies that are around us. So let's think about an analogy. I would say, first, I think maybe, like my question for Alex is, are we at that earliest stage that OpenAI is like Cisco of AI, or is it the Google of AI? So this is one question. But let's go to that analogy. I think maybe the better analogy for healthcare is not tech, is like is like airline, because like airline is very regulated business. And in regulated business, there's not that much room for innovation. I'm here, by the way, I want to say I might not be agreeing with some of these in private, but I'm here, I want to mix things up and make this a little bit, the multi-faceted. So I'm willing to play that like, pessimistic role. So I would say, when there's a lot of regulation, there's not that much room for innovation, especially, you see that right now after more than one century. I think the Wright brothers, that was like 1903 or something like that, 1906. We got to the moon in 1967, and then it's not, every year I actually travel a lot. Things are not getting easier, and things are actually getting slower. There's that pace of innovation never happened. We cannot do a cross-Atlantic trip faster than we were doing in the early 2000s. So there were businesses like banking that also, there was a lot of regulations, and they ease up the regulation. There's a lot of innovations in early 2000, after Reagan era, in 90s, in early 2000s. And some of those regulations, there were that subprime loans and the stuff that they did with loaning system, because they were very innovative. They're trying to come up with new innovation, and everything collapsed. So my question for the panelists is, healthcare is closer to tech, or is it closer to banking and airline?
Julie?
Can I lead off here?
Yeah,
Please.
I
think it's both. And actually, I disagree with the airline analogy, because if you think about it, okay, 120 years-ish of air travel, and you can go up the road to SFO and fly direct to Australia, Asia, Europe, and it's for like $1,000. So if you think about it, actually, I just think that there has been a ton of innovation. Millions of people are flying every day. It is incredibly safe. And I think the analogy to healthcare, of course, is vital, and the fact that when things go wrong in healthcare, there are consequences directly to people, same as air travel. I think that's a great part of it, except that I do think there has been a ton of innovation. And now who knows if we're going to be getting our Amazon packages delivered with drones and other things like that, set that aside. But I think that aspect of healthcare is real, and the FDA is, having dealt with the FDA quite a bit, is using, so Viz's devices were regulated software as a medical device. And the general construct is you either go out there and get a de novo approval, which is a big deal. I was really proud in my time at Viz, we did 2. Sorry to plug my old company, but thank you, it was a big deal. And then, or you can get a 510K, which is predicated on a substantially equivalent device, which is what a lot of companies, including actually like some of the new stuff that Apple's been doing with the watch, that's actually like a 510K. One of them is predicated on a Viz device, by the way, which is cool. But the point being, they have created this construct, and there's different classifications for the risk associated with the device, and there's a very clear approval process, and the FDA is actually innovating on this to include things like cybersecurity and, of course, the aftermarket improvements that algorithms do. It's a construct that actually, I would argue, is working, including that they have reduced clearance fees and things like this for small businesses. And so I think that part of it is, there are areas of healthcare where the innovation is working. There are certain areas, though, where I think your analogies are really apt, like the idea of, the data right now is not leverageable. You have companies like Epic who are controlling large swaths of the delivery system, and they are not, ecosystems that are navigable and where you can actually access the data in useful ways and integration and other things. So like I think there are quite a few blockers, and typically the barriers to that tend to be thrown up as like, oh, it's a HIPAA constraint or this type of interoperability constraint, when oftentimes it's an incumbent who just doesn't want to play well with others because they like their position in the ecosystem. And so it's a bit of a roundabout way of saying, I think it's both. But I also think that because of what, like we were talking about at the beginning, 18% of GDP, the US spends more than $10,000 per year per person, and we have some of the worst outcomes in the OECD. There's so much room for improvement in quality, access, and cost that there's, like we said, there's thousands of billion-dollar companies that could be out there right now.
Actually, because of that, I was thinking it's not like any of those other industries, because I think I try and normalize by value to the human being. Mm-hmm. And I feel like when we look at healthcare as value to the human being, there is that tip of the pyramid, to your point, where things have advanced in miraculous ways. The treatments that we have for some cancer, some autoimmune diseases, I mean, things that we just were not able to do before. The fact that we can create vaccines and be able to put them out into the world as fast as we have capabilities we did not have before. We do robotic surgery for things that we were not able to do before. So there's kind of the tip of that pyramid where we're doing really great. Mm-hmm. But then when you look at the rest of it and you normalize across industries by value to the human, which is, I think, how we should think about this. To your point, we failed on every measure. Quality has gotten worse over the 20 years that I've been in healthcare. Safety has gotten worse. Our patient experience has gotten worse. The cost of care has gotten worse. So while, again, we do have these examples that are truly extraordinary, mm-hmm. and I'm very excited about the potential of the discoveries that are coming down the pipeline, supported and accelerated by technology, I think the value to the human overall is really lacking.
Yeah.
So some of you probably know this better than I do and can correct me, but there's, I think, a Warren Buffett anecdote that when asked what he'd do with a time machine, he said, off the cuff, jokingly I assume, I'd go back in time and shoot the Wright brothers because of the amount of investor dollars lost in aviation. That being said, there is progress happening. So we have a company, Hermeus, that's working on Mach 5 aviation that I think is going to work. Boom is made tremendous progress. And so I think there's value creation. But I also think I'm guilty of this because I used, kind of reasoning by analogy. Analogy is good for communication purposes, right? Because people think in stories. Obviously, what you just heard is actually reasoning from first principles. And to be a valuable company, you have to provide value, but also do that in a unique and special way so that value accrues to you and it's not distributed. And that's a very simple first principles thing. And the point at the beginning is that there is tons of opportunity in healthcare, and it is many different things with lots of money banging around, and all other things being equal. If you look at like even framings like Maslow's hierarchy of needs, you solve a lot of material goods. You can see a lot of people get there and say, actually, I would like a little bit more health span, and their willingness to spend to improve health and wellness on the other side of that is effectively unbounded from what we can tell if you actually are providing value and can do something special. And so that's like from first principles, there's a tremendous amount of opportunity.
Yeah. Yeah.
Well, I definitely agree with that. And I think, you know, there are some dark sides of the healthcare, and you know, with that much spending, I don't know if it is a positive point to spend 18% of the GDP on healthcare and have such bad outcome among developing.
I'm going to say that's not a positive thing.
among developing countries, U.S. has the worst health outcomes, including less.
Well, let me push on that a little bit.
Yes.
Because the question is not, is 18% a good or bad thing? It's, do we get commensurate value for that fraction of GDP? Right. The other thing is health and wellness is definitely not equally distributed across all people in American society the way it is in some other areas. And so it's, you know, when you put a lot of things and you look at aggregate statistics, you're kind of mixing a lot of things in a big soup pot. You know, there have been tremendous advances, certainly in my lifetime, right? You know, when I was a little kid, AIDS was a death sentence, and a horrible death sentence that also required a lot of healthcare services research to take care of people. Technology innovation has been able to drive what we can do to develop new treatments to infectious disease. To demonstrate in the COVID pandemic, we have a tremendous amount of new technology and resources. When you have an emergent viral infection, you can actually move very quickly to new treatments and even vaccines. So if you're saying what contributes the most value to health and wellness, it would be hard to argue that the S-trap in the back of your toilet and vaccines as an intervention class have not contributed some of the greatest value in terms of health and wellness and qualities in human life ever, right? On the other hand, and many of these other things may be a rounding error, but they still could be billions, hundreds of billions of dollars of value. There's so much opportunity, and so we didn't, you know, lose sight of this opportunity and how much things have actually improved. And you know, once you solve one problem, another opens up. So when Banting and Best discovered insulin, you suddenly end up with things like diabetic retinopathy, diabetic foot ulcers, because before that, people just died. Okay, so we're able to extend life. The same thing is true of lots of developing world, where if you looked a few years ago, oh, this area has no cancer, or they have no Alzheimer's. Well, yes, but the demographics were such that you had a massive burden of infectious disease in the pediatric population that people didn't live long enough for that to be a leading cause of death. Now you have places in the world that are catching up to the kind of Western world standard of living in terms of infectious disease problems, and all these other things are emerging. So I think there's a lot of things going on. We have a lot of space to improve, and there's lots of parts of our society that are vulnerable and not getting access to life-saving preventative therapies. But there's also a lot of things that happen, and there's never been a better time, not that it's ever a good time, but for example, to get many cancer diagnoses, pediatric cancer diagnoses, many things that were, even a few years ago, death sentences, are now effectively completely curable. And that pace is only increasing. And I think that's tremendous.
Yeah. I agree with you, Alex. I think the piece that really worries me, though, is that if you take the top chronic diseases in this country that both bring forth the most kind of harm to the individual and cost. So you take everything from kidney disease or end-stage kidney disease to diabetes to heart failure to COPD. Those have all had solutions for like literally decades.
Sure. Okay,
I think our ability to actually be able to, at a population level, bring forth those solutions, that's a failing. right? And not that anyone is doing it. I used to think that other countries had this figured out, other developed countries had this figured out better than we did. And when I was at Oracle and I got to travel around the world, I mean, NHS has its own issues, the Canadian system has its own issues, but there are things that they do far better than we do, which is making sure that they are preventing the things that today really could be prevented, or if it's diagnosed, that it's actually managed so that you don't have a person with diabetes losing their eyesight, losing their kidney function, needing to be on dialysis, that they don't have someone get a stroke and a bleed in their head because their blood pressure is not controlled. So there are things that we know work that we have failed to implement effectively at scale, and that to me is a systems failing. It's not a technology failing, it's not a discovery failing, because to your point, we've done a lot of really great things at that level, but the implementation of this is still lacking.
Well, thank you very much both for reminding us these success stories. So I do believe that even, you cannot really assign a monetary value to saving a life, and all of these stories about saving lives and making lives better, these are invaluable. So these are all great.
Well, but we can talk about the economics. So one of the numbers that people use is the U.S. Department of Transportation actually does assign a value to a statistical life in terms of what they require. And I forget, someone, again, if you've got a phone, you might look it up, what the Department of Transportation certainly assigns a statistical life. But, as a level of resource allocation, people do try. And there are trade-offs. Like kidney failure is a great one, and this is kind of an unfortunate local minima we're trapped in, is that dialysis makes a lot of money for a lot of people.
It does.
As soon as you get to be stage 3 kidney failure and dialysis dependent, you are instantly disabled and completely covered, no matter your age. And it's if you travel around, even in the smallest town, you'll often see a dialysis center because that's a moneymaker. There's a whole bunch of stuff about how that's grown. It's really unfortunate. It's certainly not equally distributed, and you will see that it is primarily vulnerable populations that are there in the dialysis center. Access to kidney transplants is not equally distributed. By the way, we're seed investors in eGenesis, which is genetically engineering pigs for organ transplantation, and that is now working, and I think is going to save lives and increase. But people should never get to kidney failure. And you don't just end up there unless you have an autoimmune condition. It's over years, and even the most simple medical informatics, looking at your lab trends, can detect progression. 80% of patients, the first time they meet with a nephrologist is when they're signing up for dialysis. It's just a massive system failure. And blood pressure is a great contributor to kidney failure. Okay, 80% of people are not well managed with blood pressure in America today. Now the UK is better. It's around only 65 to 75% of people there are not managed, so better but not great. There's something like 219 different blood pressure medications. So if something doesn't work, we can find something for you, as well as all kinds of digital health programs. And we have a company, Hello Heart, that actually is really good at providing the right nudges. And they've been able to get to 40 millimeter mercury reduction in some of the most severe hypertensive, particularly people who don't like interacting with healthcare because they don't like a guy or gal in a white coat, this young kid, to yell at them to stop smoking and exercise more. And that's another example of where AI is able to do a thing that human beings we just don't staff them to do. So the ability for a person to affect positive behavior change is negatively correlated with educational attainment. What I mean by that is a pulmonologist or cardiologist is the least likely to get a patient to do any kind of behavioral change. Primary care doctors, better, but not great. Nurse practitioner is better. Nurse, better. Kind of nursing assistant kind of person, even better at driving outcomes. A kid that you just hired from retail, working at the Gap or something like that, is even better. They're the best person at getting someone to make a positive behavior change in their health. But if you keep continuing that curve, an AI system which is non-judgmental, ever patient, ever available, can always engage with you, is even better. And the marginal cost, the great thing about that kind of property is the marginal cost of that person's time is the worst in the worst performer, and the best, because software is kind of free, in the best performer. So that's the world that we can enter. Now, all CMS has to change how they reimburse for things and all kinds of other things, because most MA plans are not. Anyway, that's a whole separate thing. But it is possible, and I am think that I actually think this is a great thing that Mehmet Oz is going to try to work on. I think there is a positive light there.
I love it when Alex can read my mind and actually, answer the question I was about to ask. But, as, we want to move on to the next question, more talking about the clinicians and the medical education. Maybe we can wrap up this discussion, the first part of this discussion, with the very rapid answer is this following question. So we learned there's a lot of good things has happened because of modern medicine. Also, there's a lot of things are wrong with our current healthcare system. But as they say, the nice thing about hitting the rock bottom is, the only way that you can go is going up. Things only gets better from here. I'm not saying that we are rock bottom at the American healthcare system, but the good thing is there's so many things, and as our panelists said, we can do to make this current situation better because the standard is so low. It's not that we don't have access to good innovation and technology. Actually, U.S. is the leader in terms of healthcare technology. Unfortunately, implementation, and that's, the disparity in access in the U.S. is the worst. So you don't get the value of the money that you pay. So this is like kind of very rapid, I guess, the question Q&A for all the panelists. So we have some students here that they want to jump into entrepreneurship in healthcare and AI and the intersection of healthcare and AI. And there are so many different verticals, aspects here, from consumer health to healthcare delivery to insurance to, healthcare administration. If we want to give an advice, like one application that you advise a newly minted Dartmouth student to jump into and start, what do you recommend?
I'll answer the question because it's an interesting question, and I don't think there's a singular answer. Sorry. But the reality is, I did out of Tuck what a lot of students do. I went into consulting because I didn't know what I wanted to do yet. And people make up different reasons, but generally speaking, MBAs who go into consulting, that's okay. It's like let me take another master's in business to decide that. I think the reality is when you're choosing a company, whether it's in healthcare or anywhere, you need to figure out the things that you care about in that company. And for me, I've been very fortunate, thankfully, that all of the health tech companies I've been a part of have either been bought or are successful or have IPO'd. It's pretty unusual. But I think that the things that they have in common are, one, is this a problem that needs to be solved? And I think this is true, again, in healthcare or anything. Is this a problem that needs to be solved, and is it something that I'm going to wake up every day excited to work on? Because if it's not, I think, and one thing to keep in mind is that just because you don't know a lot about it now, everything gets more interesting, well, not everything, most things get more interesting the more you learn about them. Okay, so just because it isn't something that you were expert in for 20 years doesn't mean that you won't find it fascinating and that you won't become expert. In fact, actually, there's a lot of literature out there now talking about range, and diverse experience is actually the best thing to prepare you for the next thing as opposed to being a specialist. But the reality is, I think, is it a problem that needs to be solved? Are these people I want to be associated with and that I want to spend my time with? Because those are people that you're going to spend more time with than your loved ones. And especially if you're going into a high-stakes industry like healthcare, there are lots of examples. I was in a very formative time when the Theranos debacle was going on. And I remember reading the Wall Street Journal articles as it was coming out, thinking, I can't believe this is happening. And I'll just be blunt, as a woman, I was so pissed because it was like the first female CEO who had gotten a lot of great funding and everything. It just felt like a big step back. And so it's a sidebar. But I think, are these people I want to be associated with? Do they have high integrity? Do I want to spend time with them? And then the third thing is actually looking at, can this company succeed in this space? And is this a space that actually has a business value? That's the criteria that I have literally approached each of these companies. It's matured over time, but that is a way I would approach what you're going to do next. And if you're answering all of those things, yes, 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 then I think it's worth going into. It's not necessarily a particular area, but I think, you know, there's lots of value. I've been in the application layer now for 15 years, and I'm really excited to be going into an enabler infrastructure area where I'm actually not selling into hospitals where sales cycles are 12 to 18 months and margins are tight. And I have great respect for hospital administrators, you know, and people doing delivery, but there's pros and cons to being on either side of that. And I think if you're really attacking it from sort of a fundamental first principles view, I think that's how you should choose what you want to do, as opposed to this is an area. Having said all that, I do think that macro trends matter. And so looking at spaces that are getting general investment is generally a good area to be in. It's hard to be the best company in an area that's just not getting any investment, right?
So I think you articulated that perfectly, and I would go with that advice. I'm going to make it a lot simpler. You said, what advice would you give people who are coming out of their educational experience and looking at healthcare? I would say, please come to healthcare. We have got a lot of problems, and we need your brain power to solve it. And I think to Julie's point, you have to find what you're passionate about, but there is not another field that is as mission-driven, that is impacting the lives of people at every single level. If you do not have health, you cannot plan for the future. If you don't have health, you don't go and get educated. If you don't have health, you're not able to be joyful and get to spend time with your loved ones. It is the basic thing that unites all of us, and you get to be part of ensuring that that happens for whatever population, whatever problem that you care about. And I think that that's one of the things that for me, like I get asked all the time, people are like, well, it's like medicine is a mess. Would you ever do this over again? I'm like, absolutely. Because I didn't go to medical school and residency training to practice medicine the way people did 20 years ago or 30 years ago. By the way, if anyone in any business went into it because they wanted to do things like 20 or 30 years ago, there's something wrong, right? You always want to be looking forward. I went into healthcare because I wanted to be part of helping people be healthier and be able to have more fulfilling lives. And that is more true today, and we are more enabled to do that today and have way more tools to do that today than at any other time. So please come to healthcare. That's going to be my simplified message.
Thank you very much for this.
Can I add one more thing? Because I'm glad you guys went first, because I can't, except I would amplify something that Julie didn't say, and maybe please don't go into consulting. So management consulting, I mean, I'm from New Hampshire, and it's a lovely place. I think Hanover's lovely. For those of you who are there now or were there, you may not have the same reach in some groups that go and recruit there. You know, there's a certain flavor of reach there. But we're at this critical time. And if you go into management consulting, you're going to be probably advising some larger entity on what their digital transformation in the age of AI strategy is going to be, probably, right? There's billions of dollars being spent on that for consultants. AI is probably going to replace management consulting, first of all. So you're in an industry that's semi-moribund. The second is we're at this critical time where this is clearly going to be a big part of the future. And if you wind the clock back 30, 40 years, do you want to be a person that was like, I spent my really productive, energetic years advising Coke and Walmart on their internet strategy, or do I want to be part of the journey of that transformation that's happening much more directly in the groups that are actually going to affect change, and reach out and try to grab that future? The future isn't written. It's written by people in the room that go and try to grab that future and pull it into reality. And you're at this such wonderfully transformative time. Julie kind of framed it one way, but if as long as you're in the boat going in the direction, even if you don't pick Amazon in the early stages, but you kind of can then quickly identify what is Amazon and jump over to the right boat, and you've already have moved in the right direction, and actually have operational valuable experience that whatever the Amazon equivalent is will want to suck you in. So please, please don't waste your talent advising big companies on their AI strategy. It makes me sad.
I appreciate that, and also I was a terrible consultant, so I didn't last very long.
Yeah.
Well, thank you very much, all three, for this very insightful advice. So I want to change the gear a little bit, moving on from the entrepreneurship and innovation in this domain to, talking about clinicians and their role and their future, especially since we have two clinicians, MDs, on this panel. So in my career at Dartmouth, I've been fortunate to work with many clinicians, physicians, MDs, and learn a lot from them. And at Dartmouth Medical School and Dartmouth Hitchcock, similar to many academic hospitals and medical centers, we have physicians that are very avant-garde, very open-minded when it comes to technology and AI. But I cannot remember this. I had this interaction with one of my colleagues over the age, back in 2015, and he was very hostile. He was telling me, what you're doing is replacing us. You're trying to, I'm not gonna, give away I'm giving away his gender, but I'm not gonna give away his specialty because it's, it's a small world. But he was telling me, you are trying to, what you're doing is wrong. We have this old tradition, the way that we're doing through training, and it works, and I don't like what you're doing. So I told him very naturally, what are you doing here? Because we had the AI project in healthcare, and he was helping us. He was our advisor and our annotator and evaluator. So he told him, well, if you are so hostile and pessimistic about this, why are you here? Why are you helping us? He said, because if you cannot defeat us, you join them. So that was his attitude. And that said, I should say, that's not the feedback or interaction they mostly had at Dartmouth or most of the medical centers across the country. But I would say this kind of reaction is much more severe or more common in community clinicians, maybe the physicians that are not working at the big medical center or at the big university hospital. So I want to ask all of our panelists, do the physicians need to be worried about the future of their work?
Yeah, I think worried is not the term that I would use. I'd say, and I think we heard a little bit about this during the lunch panel, and Alex was hinting at this too. The people who are going to be successful, whether they are physicians, engineers, lawyers, whatever specialty you're in, are the people who are forward-looking and grabbing that future, as Alex said, grabbing that future and bringing it forward. If you're constantly looking at how things were done and you want to keep doing them that way, no matter what field you're in, you're going to be in trouble, right? So I think this is, I feel bad. I feel really sorry for that person. I was reflecting as you were talking, Saeed, because I know a lot of people like that, and I've had conversations like that. And at the end of the day, all of us as a society need to embrace and be enthusiastic about what the future holds and be active participants in shaping the future. I wouldn't be worried about what AI is going to do to my job. I'd be worried that by me not being active in it, I've spent the last 20 years doing way more administrative work than I should have ever done. The ROI of training me through 4 years of medical school and 3 years of residency to then do a bunch of paperwork is completely nonsensical. I mean, talk about waste that we could eliminate out of the system. So yes, please have AI dictate the note and write the note and even tee up the orders. And as my professional responsibility, have AI provide clinical decision support so I don't do the wrong thing for my patient or I don't forget to do the right thing for my patient. There's a caveat to what Alex talked about populations that are most vulnerable usually get worse care. That is absolutely true. We have great data on that. But I promise you, having worked in organizations with large percentage of PPO patients and people who are self-pay, not because they don't have insurance, but because they have that much cash, those people are not getting evidence-based practice. And it's not because evidence-based practice doesn't exist, it's because we have long surpassed the cognitive ability of a single human being to remember all the therapeutic and diagnostic options that are there, and at the 15 minutes or the 2 hours that they have with the patient, be able to bring that forward and make sure that they're not missing anything. And so instead of being worried, I would be excited and embracing and helping build that future. That's not a skill set that we have trained people to have in medicine. I do think that that is a skill set that's absolutely necessary as we move forward.
Well, Julie, what do you think?
So I was curious about what the other, I'm not a clinician, but I think
I work with a lot of them,
things. So I think there's a couple of data points that are relevant here, right? One is, I think it's in the next 10 years, baby boomers will all be over 65, right? We know that people consume more healthcare, have more imaging, have more needs as they age. And so we have this increase in demand for healthcare, and we actually already have a doctor shortage and a nursing shortage and a shortage of home health care. And there's millions of people. The biggest employer, I don't know if it's still true, but the biggest employer in San Francisco is healthcare. It's not tech. People don't realize this. And so we have an increasing demand. We already have a shortage to meet that. I think the bridge is going to be made by AI. So if you were saying, I'm a med student, what should I be doing? I think, yes, you need to be embracing healthcare, and you need to be embracing AI, and you need to be thinking about how can I deliver better care faster? How can I leverage the technology that I have available to me in order to do my job better and more efficiently? But the reality is, we're not going to have an issue with doctors or healthcare delivery needing, we're going to need those people. We already need them desperately to bridge the gap. And my hope is that over time, actually, we not only bridge that gap, but with the AI enables people to actually practice to the top of their license. An interesting anecdote, my mother had gotten some care and said, oh, it's weird. My primary care doctor, I didn't get the aftercare notes because I was asking her about, well, what did she recommend? And she said, well, let me see. She said, oh, I haven't seen the note yet. I usually get it the same day. She got the note 72 hours later, and her PCP actually wrote, hey, I'm sorry, our scribe was down, so I was behind on my paperwork. And I thought, there's big companies like Abridge, there's a bunch of them out there now that have massive valuations, and I was thinking, this is kind of fascinating this is actually how AI is absolutely delivering an improvement in the delivery of care and making this doctor's life easier. And when he took it away from this doctor, suddenly the patient noticed and the physician was apologizing. And I thought, oh, that's a really interesting moment, right? And there's going to be more and more of that. And I think, frankly, the scribes and a lot of the note-taking and stuff, that's going to become a commodity, which is actually great. The price will come down. And then we'll move on to the next thing and the next thing. And that's, again, how this bridge gets made. And I think, hopefully, how delivery improves, access improves, and cost comes down in the system.
How many people here have ever been in a Waymo? Raise your hand. If you haven't, is it like you haven't been around where one is, or are you scared? Or maybe people scared? No one's scared? Great. Because I think that's, to me, a great analogy for healthcare, in that there's a huge amount, there's almost like a complicated ballet of vehicles and logistics and things moving around. And you can't just introduce something, it has to integrate into that system. But if you ever get in a Waymo, for those that haven't and those that have, it's a little bit different than a human driver. But I think you would say it's actually a better experience. And the data certainly suggests, the equivalent, if this was rolled out in the country, it would be, the equivalent of deaths from breast cancer just disappearing in accidents if we rolled Waymo out. And that is a future that we should think about. What are our real goals in improving the experience and reducing problems as a primary goal, and not about job protection is a secondary thing. And it's a hard thing to say, and no one likes to be disrupted, and there's a lot of pushback, and we need to find opportunities. And there are things for people to do, and it isn't instantaneous that these things take over. But that's the thing we should focus on, is the basically the product quality, its availability, and its cost per unit of value. And that's the thing we should hope for. And if you're against that, then you're kind of against your patients as the primary focus, and that makes me sad.
I think that goes back to somehow the point of healthcare has become to employ people, which kind of goes to your point about what a big payer, what a big employer they are. But the point of healthcare is not to employ people. The point of healthcare, Alex, as you said, is to make sure that people have healthy lives. And so again, it becomes your responsibility to make sure that that's what you're doing, and that's going to evolve over time.
Well, these are great insights. I think what all of our panelists agree, there are going to be a lot of changes, but from my what I hear also here today and from outside of this room, a lot of experts, they disagree about how change is going to occur and the direction that this that the AI is going to make an impact. So you guys might have heard that I think it was 2015 or around that time that Jeff Hinton, one of the pioneers in deep learning, on a panel like this, he said, the radiologist, he compared radiologists to the coyote from, Roadrunner, like cartoon, that they have fallen off the cliff, but they don't know it yet, and they urge the healthcare system to stop training radiologists. I get this, question from physicians, even from my, family members that are in this domain, what they should do for not replaced by AI. And I'm gonna tell what I tell them. I tell they are physicians, they either do pattern matching, they work with their head, or they work with their hands, like surgeons. I tell them, do more things with your hand. That's like way more, some people disagree. But that's why I'm actually bringing it up, why I want to say what other people think. So,
I have a quick question for you. Did someone today mention that AI was invented at Dartmouth? I'm sure they did. Okay, I just want to. I feel like we're in the History Museum. If someone didn't mention, that would be like an egregious.
Yes, there are. So I feel that as a panelist, as a moderator, is my role to push back a little bit to let this all of this wisdom and insight to come out of on our panelists. But one other point that I want to push back is this, the notion about shortage of physicians, because I know many people, either at the stage of residency or people at post-residency, they want to earn job market. I tell them there is a shortage. You guys all set in terms of finding a new job. But they say, no, that's not the case, because majority of the jobs are places that they don't want to go. And I don't want to, offend anyone, but I have a friend that didn't want to go to Kentucky or Arkansas, wanted to be on the coast. And to be honest, I cannot blame them. So there are a lot of jobs, but, physicians do not take many of those jobs. So this notion that right now we have a shortage of jobs, if I was a medical student or a resident, I would have pushed back on this, because it's very competitive to get a job in this the places that they're very popular. So with all of those, is the residency program going to be the same, or the specialties that they do a lot of medical, reading the medical images, like pathology or radiology, ophthalmology, dermatology, they're going to be the same in 2035? Or the training for these should change, because AI is going to transform how they're going to be practicing in 10 years or so?
Well, I'll start. I mean, medical training needed to change a very long time ago. I think 15 years ago, I wrote this piece around, we got to stop teaching the Krebs cycle in medical school. And for those of you not with a biology major, it's basic biological process. We spent a lot of time when I was in medical school teaching about it. Turned out that they were still continuing to teach it. And it was at a time when we really needed physicians to understand healthcare economics and the operations of healthcare. So instead of having things done to them, they could actually be active participants in designing what the future of care should be. It's why I, after many years of being in practice, went and got my MBA. And I was like, swap it out for things that people actually need to know. I have not used the Krebs cycle, not once, while I've been taking care of an acutely ill patient in the hospital. Neither have any of my friends and colleagues in any other specialty. So I think, again, to me, you have to go back to what is the purpose of education. And if the purpose of education is that you want to prepare people for what is the current state of affairs and what they should be thinking about, then absolutely. We are going to need to rethink medical education at every level and both prepare people for the skill sets that are necessary to be active participants today. That kind of takes the fear away too of I'm going to be replaced if you're an active participant in it, and also what the future can potentially hold. I will say, so I've got two younger kids, one in middle school and one who just started high school. And it's a topic of conversation around with parents around like, how do you future-proof stuff for your kids? And I hate that because I'm like, how do you know how to future-proof? You cannot future-proof. There are technologies today that I could have never imagined when I was in college. And there are going to be technologies 10 years or 15 years from now that we cannot imagine. How about teaching people to think critically, to be curious, to want to learn, to want to grow? Those are future-proofing skills. But the funniest thing to me was one mom was like, you know, I told my kid she should become a dentist because you're always going to need to go and see someone to work on your teeth. And here I'm thinking to myself, like, what if tomorrow we come up with something that just gets rid of dental caries completely and you actually don't have the same volume of cavities that you do, or all the technology that now we have with Invisalign for braces that you no longer need to have kind of some of the specialties that you had. All of this to say, I think trying to future-proof things is not the right way to think. We have to go back to what are those core skill sets that people need to learn in terms of critical thinking, curiosity, being uncomfortable. Like we spend a lot of time talking about like, you're gonna be uncomfortable. You look at like these sets of jobs, I mean, it's
I'm uncomfortable all the time.
All the time. So if you want to be happy and do what you trained to do 20 years ago, that world doesn't exist anymore. This is the real world right here.
So we're in a history museum, and I might share a anecdote. Maybe this weekend you can share this at a cocktail party. But the residency program, actually the medical education system in the United States and residency as we know it, actually comes out of basically 100 years ago what they did at Johns Hopkins. And the reason they had residents as we think of them, they lived at the hospital. And it was started by William Halstead, who was head of surgery. And he had come up with the idea of direct injection of cocaine into nerves for a local anesthetic, and he experimented on himself and became, unfortunately, a very serious cocaine addict. And then this new drug, this new heroic drug, was supposed to cure a lot of problems that would help that. It was developed in Europe called heroin, and so he started to get heroin therapy. So he was a cocaine and heroin addict. And he was a brilliant surgeon, but he was very unstable. And he needed a cadre of people to manage his patients. And so he had these residents. Look it up. And so that was the foundation of medical residency in the US. The other anecdote about history, that's like over 100 years ago, the other anecdote about history is the current case-based reasoning used in medical schools and didactic programs actually came out of Harvard Business School. It was a business school innovation that then went into healthcare. The point being, these are old processes that were built with reasons that had nothing to do with what we do today, and of course need improvement.
Well, thank you so much. Well, I'm gonna ask one more question because we talked about healthcare from point of view of entrepreneurs and also clinicians. Maybe I ask a question about role of AI in this domain from the consumer point of view. And then I know we are running out of time, but hopefully we can take a few questions from the audience. So I'm going to ask this very quickly. So, a lot of the healthcare, a lot of these AI models, especially in healthcare, are trained on patients' data. As a AI researcher that work at academic medical center, I personally, benefit from this a lot because we are working at the academic medical center, and patients automatically consent for the data being used toward research. So it's relatively easy to access your data, but we are not a commercial company. But there's a lot of startups, big companies, or the middle-sized companies that are active in this domain. They are actively working to get access to patient data for building those large models that require a lot of data to develop. So from the consumer perspective, is this fair? Do consumers need to explicitly be told how their data are being used? Do they need to get paid if their data is being used and contributing toward a commercial endeavor or a commercial model? What are your thoughts on that? Or this is basically crippling the innovation?
I'll give a short, my hot take on it is no. With the caveat that the assumption is the business models that the company delivering the service is relying on likely doesn't work. Now, maybe it does if you're reimbursing patients, but I think that the reality is you are ostensibly benefiting from the service, and our data, Claude, OpenAI, these things are not, none of these tools are free, right? You are the product if you're not paying for the product. We all know this. And I think for most businesses and in healthcare as well, I think we have to be very careful about PHI protection, of course. But the reality is patients probably don't, but I do think that we need to be much more thoughtful in general about, all of the AI companies are hoovering up data, and the sources of that, if their business model is then being disrupted because they're being disintermediated, it's creating real challenges. And I think, we need to be much more thoughtful about it. I don't have a great solution to it, but I can't imagine a world, and I'm literally just thinking about how do you build an app where it's like, finding a way to reimburse each patient, X dollars for a de-identified MRI, right? Like I don't see a world where that works.
Okay. Well,
I might be thinking too much like a COO and not as much like a strategist, though.
Does someone know what HIPAA stands for? Anybody? What does it stand for? Health insurance portability. It is not really, I think, now everybody disagree, about protecting your privacy. It's about ensuring that health insurance companies get access to your data. That's actually what it's about. And I think if you look at fundamentals, would you want access to someone trying to do discovery of maybe curing a disease that you or your family member has that the next generation could be treated for? Most people actually would I actually want researchers to get access to my information. I don't need to get paid for it or have any, just help for me as a human being that if the next, so Hippocrates, who in the very earliest writing said that physicians should learn how to read and write, which was kind of an innovation at the time. A lot of people were illiterate. Why? So that a physician could share their case records and history with the next generation of physicians so they could better treat their patients. Thousands of years later, we do not have that capability in any organized way. And that was recognized very at the earliest inception of defining what a physician was, that people should record information, share it to make new discoveries, and improve health. And I think fundamentally we would all like that. And we actually have a system, including something that you've probably all signed a document at least, 50 times. It's about ensuring health insurance companies get access to your data. It's really what that's all about. That's, I think, one of the key principles. Now, one of the challenges about actual large health system data is that much of it was generated for billing and reimbursement purposes and doesn't reflect. So like, what is a diagnosis? What's an ICD-10 code? It is a low-dimensional representation of a complex person who's full of all kinds of things, hopes, dreams, all kinds of varying states, and you're turned into a 19th century concept of a diagnosis code to really rationalize some future billing event. And so the devices in your pockets that I'm sure all of you have probably have more. If you have one of these things, watch, whatever, there is more health-related information that you're collecting out in the world that can be used to improve your health and is being done today. That's, I don't know, I'm kind of answering different points, but something to think about for you as I kind of encourage, the whole point of being here is encourage you to go do interesting things, is there's a tremendous amount of opportunity. The last point I will say is you kind of, is most people will waive health-related privacy just to make things easier, to use SMS chat. Like people are like, well, that's much better. I'd rather have an experience where I can use SMS chat than go into some app with multiple authentication. It's just easier, and I don't really care. That's the kind of the reality of the world we're in and what people actually want. And so there's a tremendous opportunity there.
I mean, my short answer is everywhere outside of just directly delivering care. Because if you look at healthcare, it is an incredibly large and complex business, right? Whether it's healthcare delivery, it's pharma, it's payers. And using those business principles, I mean, I think that's what, for me, I found incredibly helpful from my MBA education, is using those principles as you're looking at how do you build an effective, robust business that is delivering value to the person, can be applied everywhere in healthcare, from the exam room to the operating room to how you do prior authorizations to how you do clinical trials management. Your second question is a much harder one, which is how does one break in? And I think for students, I always encourage them to get involved in internships, to come to meetings like this and connect with people who are actually in healthcare to see what are opportunities where you can actually volunteer. There is no substitute for actually rolling up your sleeves and getting involved. And I think, again, our lunchtime speaker was talking about that too. So finding ways in to really experience what this is like, you will find opportunities to make an impact, I promise you.
Yeah. Can I quickly?
Yeah, please.
Just real fast, be super practical. You are a Tuck alum. Tuck alums will answer any message from a Tuck student. So email, look at the alumni network, leverage the broader Dartmouth alumni network also. I think that's a really important way to differentiate yourself. And my advice would be, do not be too concerned about what the position is, the role is, or the seat is. Get into a company that you're excited about, a space that you're excited about. My big liftoff moment happened, I applied for a BD role. I was told, we really want someone who's done a lot more deal flow. We're gonna pass, but what do you think of implementation? And I was like, what is implementation? And then it actually turned out that I loved it, and that has been my career in operations. So don't worry about the seat. Think about a company that you're excited about, and leverage the alumni network, get in with that personal this personal answer, and have the call, get the next call from that call, really just tactically push that way. Sorry.
No, I build something you said before, that if you dig in, it gets interesting, and you also figure out how to solve it.
Yeah.
You have a person with a body and have, there's always something there to think about problems you have with healthcare. You have relatives, I'm sure, loved ones that have a terrible experience with healthcare. There are tons of opportunities that has been highlighted where people don't have a great experience, and there's just sitting next to you on a giant set of technology and innovation that's happening that most doctors don't even understand what's there. So you can sit and much better to focus on the problem that you're passionate about and get people to help you learn to bring innovation that even the experts that are only experts in the old world, not this new future, because the future's not here yet, you're a great opportunity time. Yeah. And just find something you get passionate about.
Time passes so quickly, and I think we were just getting started, but unfortunately our panelists are very busy people, and we promised them that we stop sharp at 3 o'clock. So I'm sorry that we should stop here. I really appreciate all the insight, all the advice that our panelists gave us to take the time from their busy schedule to be here. Thank you very much for your time. And I hope that at least some of them can stay afterward to answer your questions. And also, thank you very much for spending your afternoon here with us and engaging with panelists. Thank you.
Thanks. Thank you all.